Welcome back to Good Morning San Diego. Many people are looking for ways to stay healthy as San Diego's restaurants and stores continue to reopen. And joining us with more on how to stay safe and things to keep in mind during this time, Dr. Georgine Nanos is here. She's CEO of the Kind Health Group. Dr. Nanos, great to see you on this Sunday.
Hi, Liz. Great to see you, too.
You know, I think this is an important reminder for everybody because as we are now able to get out and about more and start going to restaurants and start going to do more shopping at retail shops, you know, our guard may be down a little bit. What is the most important thing that you think that people need to keep in mind?
You're right. It's a great opportunity that we're able to get out and enjoy life a little bit more, but we also have to keep in mind that we all have a responsibility to each other to maintain that physical distance, to wear our masks in public, to wash our hands as frequently as possible, use hand sanitizers, not touch your face. Kind of the basics that we've been talking about from the beginning are more critical now than ever because it's up to all of us together to work together to keep each other safe.
How are things for you guys at Kind Health Group? What kind of, what's the situation right now as it relates to COVID-19? Are you optimistic in the direction that we're headed, or do you still see this as a great concern?
Well, I'm cautiously optimistic. So we, as a medical group, we have a really high standard for safety and sanitation measures. So we, at a baseline, had a pretty high standard, and now we've increased that even more. We're staggering appointments, so we don't have more than one person in the office at the same time. There's nobody waiting in our waiting room. You get, immediately put into an exam room, so we don't have that interaction. And, we're sanitizing everything every couple minutes, it feels like. So we're taking extreme measures. Obviously, our providers are all wearing masks. We have plastic guards up in front of the lobby, and just really doing everything we can, doing temperature checks when people come into the office. And so you're going to see that, in a lot of facilities, not just medical offices, but even at restaurants. We were seeing that over the weekend already, which is good.
Yeah, something else I wanted to ask you is something that I come across quite often, to be honest with you. And this is from, family members like my older aunts and uncles. They'll say, well, what if you start feeling sick and maybe you're not sure what it is, maybe you feel like you're getting the flu, you're starting to cough. What do you advise today if someone gets sick and they're not sure and they think, well, is it COVID, is it not? Do you think people should just kind of self-quarantine, deal with it, or head out and go get tested?
So we're kind of going again back to the basics. If you feel sick, you have to stay home and contact your physician. I would not go out and about. This is just the basic stuff we've been talking about from the very beginning. 10 weeks ago, we were saying the same thing. So if you feel sick, stay home, quarantine yourself, contact your doctor. Most doctors' offices now, primary care offices, have really been able to pivot towards managing a lot of their patient care through telemedicine, which is great, and we also do that. So you want to contact your doctor and figure out what the next step should be, if they can help you manage over the phone. If you do need testing, they'll direct you to the right kinds of tests that you can get. Right now, there are a lot of different types of tests out there, so we have to be careful about, you don't want to just make that decision on your own. You want to do it in collaboration with your healthcare provider, so you're taking the best possible step to secure your health and the health of the people around you.
Yeah, and I ask you that because I think it's important, like you said, to go back to the basics, because as we continue to move forward and the economy starts opening up, and it's good to remind folks of the basics of what to do if you think you're getting sick.
Right. Yeah. Stay home. Quarantine yourself, make sure that others around you are, aware that you're sick, so they're not being exposed to you. And then, again, it's all about washing our hands.
Yeah.
This is the most basic thing. Wash your hands, don't touch your face, use an alcohol-based hand sanitizer, wear a mask out in public if you think you're going to be within 6 feet of other people, make sure you're not gathering in large crowds, and, cover your cough if you have a cough. Obviously, if you have a cough, you shouldn't be outside, but if you have allergies and that kind of thing, you want to cover that cough. So it's just really important that we're all respectful of each other. It's our personal responsibility to take care of each other and be kind to each other. And the other thing I think is important to mention is there's a lot of there's a lot of social media shaming of people doing one thing and not the other, which I find a little bit crazy out there. So I think everyone just needs to do the right thing. That's the right thing for them, and kind of stay the course and be responsible.
That's a good point. Dr. Georgine Nanos, thank you so much. We appreciate you taking the time to visit with us on this Sunday morning. It's all about keeping people safe and healthy.
And be kind to each other.
And be kind. I like that. Thank you. We'll see you soon.
Okay, bye-bye.